Well, to be fair, I don't think it's an issue that should be blamed on hospital staff. I mean, I've spent, as I say, almost 20 years of my life working in Crumlin, and I think I know a little bit about it, and I don't think this is an issue that you can expect every member of hospital staff to be aware how the system is managed on the ground. So I've absolutely no doubt that every member of the hospital staff in Crumlin are hugely committed to doing the best they can and do day in, day out for the people they serve. And to be fair, they deal with the most complex cases in the country from the point of view of childcare, which thankfully is a relatively small number but hugely complex. I think the issue is how the actual money is actually managed within Crumlin, the same as every other hospital in the country. And every hospital has had to actually deal with the fact that we have had demands from government, and I think reasonable demands in the present environment, that we reduce our back office costs. And look, it's simply put, that's what has to happen in Crumlin as well as everywhere else. And I think, to be fair to the staff in the hospital, they equally deserve to be fully informed on those issues and those figures. Any figures that we've put out into the public are the figures that have been given to us by Crumlin itself and validated. They're not by them. They're not figures I make up.
But they are contradicting your suggestion to the Oireachtas Committee that there was an opportunity for Crumlin to cut backroom staff, to cut overtime payments, to cut the amount of money that they've been paying for banks of blood as well coming into the hospitals. They're disputing those figures and saying there is nothing more to cut in those areas.
Well, I don't think so. I don't think I've seen that being disputed. I think in relation to changes in things like cutting back on allowances and overtime payments, I think there may be some challenge. But for most of what we've suggested, and by the way, that's been achieved across the vast majority of the rest of the hospital system, what we propose, so I think it can be achieved in Crumlin. In relation to the bulk of what we've proposed, which is up to 2.5 million saved on blood, we're not even asking Crumlin to do that. We're just asking them to hand over the contract to a much larger blood procurement structure in St. James's. So we're not even asking them to do it. That's 2.5 million straight up. In relation to increased income of up to a couple of million from private insurance, again, that's absolutely just an issue based on a more active billing process and indeed a more adventurous approach, just to say, to making sure that we pick up that money. So this isn't money that's actually up in the smoke. It's actually there, and it's reality.
But I suppose, you see, this is where the confusion comes, and you don't know who to believe, and people are watching what appears to be now a real conflict going on between people like yourself and the HSE and senior managers there, and the management and the consultants and the hospital staff at Crumlin, because I have seen an internal document from Crumlin that clearly disputes your suggestion that there could be €2.5 million worth of a savings from the management of the blood products. And they're saying, and I'll quote you, to suggest that Crumlin's inefficiency or unwillingness to cooperate has lost potential savings of €4 million is simply not true. And this document says that the figure represents almost the entire Crumlin expenditure on blood in 2008, 4.9 million, and could only be saved if almost all transfusions were to cease, a clearly untenable position.
No, well, that's, I mean, again, Crumlin has spent over 4 million on blood. It's allowing over 2 million of a contingency in addition to that. So that doesn't seem to be mentioned in the document that you have. What we're saying is we will take responsibility for that, because we believe we can deliver that blood through a larger system without that contingency. So, again, you've got to
there is a reference to the contingency, and again, this can be very, we're going down into the minutiae of the detail here, but there is a suggestion that the contingency, the 2.5 million for the contingency, has to do with retaining blood, and in Crumlin you cannot give blood that's over 12 days old to children.
Look, I mean, that's not if you or I sort of can. All I can tell you is there are hugely developed systems in this country for the management of blood at a national level, and we're absolutely reassured. In fact, the best quality control systems in the world, for instance, would exist in relation to haemophilia and blood in the structures we have in St. James's Hospital. I don't think anybody can argue that that's not going to be a safe system. So, look, there are challenges in all these figures because we had a major sort of argument going on in the public in relation to frontline services for children. I think we all need to step back and say, this is about frontline services for children. How can we deliver those services? We all need to work together. And I am absolutely convinced of the commitment of people in Crumlin, and I have good reason to be, that they want to do the same. What I'm saying is, and I'm clearly saying is, we can open that capacity, provide these services if we work together and do it within budget. Now, we can spend forever
going through different
wrong.
details.
The proof of the pudding will be, can we get on? Can we do it? And we're saying, quick cooperation, work with us, with the type of expertise we put in to look at what's going on. This can definitely be delivered. And to be fair, we need to work together to do that.
But why haven't you been doing that up until now? Because it appears that this problem, and it was brought about obviously by these very tragic pictures of children who have been denied operations, and the scoliosis patients in particular. And it seems like that it's only now that this has surfaced, that the likes of yourself and then Crumlin, you're saying, well, we need to cooperate. But isn't that the whole point about the establishment of the HSE, that level of cooperation should have been established years ago?
Well, first of all, I mean, Crumlin would assure us that nobody has had their surgery cancelled. And again, that's not my saying it, that's Crumlin. So how that ties with the media reports beforehand, I can't answer for that, okay? All I'm saying is we've been really absolutely assured in writing that operations were not cancelled, okay, that needed to be done. What we do need to do is schedule more going forward to get done. In relation to the HSE and the voluntary sector, Crumlin, there seems to be a view that we have a day-to-day input into managing not only Crumlin but the Mater Hospital, St Vincent's Hospital. We have little or nothing to do with the day-to-day management. In a legal basis and in every other way, these are totally independent authorities. We hand them over a budget to deliver a fixed amount of service each year. It is totally their responsibility, and indeed they control that, and they're right, their independence, but with that independence comes the responsibility to deliver. I cannot arrive on the doorstep of a voluntary hospital in Dublin and say, by the way, we now today want to sort out this problem for you. In this particular situation, the opportunity to go in and look at things closely arose because of the huge issues that arose in relation to children getting frontline services. But it's not at all as simple as us just deciding to go in and manage.
No, I'm sure it's not. And it seems to be an incredibly political situation, the ongoing wrangling between the HSE management and the individual hospitals. But it isn't also the case, though, Professor Drumm, that you just simply hand over the budgets to these hospitals and say, off with you now for the next 12 months and make sure that you don't go over your budget. Aren't you, you may not be in daily contact on day-to-day management issues, but you're certainly in regular contact with these hospitals, aren't you? Crumlin has been saying that it was giving you reports and dealing with management under the HSE on a monthly basis at least.
We get performance reports. We set a service plan each year that says this is what St James's Hospital will deliver, this is what the Mater Hospital will deliver, this is what Crumlin will deliver. They have to report each month on what they're delivering. They, however, have no interaction with us. And you can argue in the vast majority of cases, nor has it been necessary, because a lot of these institutions manage very, very tightly how they deliver for the public. But there is not a situation where we can actually say, sorry, we're not actually happy that you're getting proper value for money, we're coming in here tomorrow. And I don't think we should have to do that. I think what we now need to do is sit down with Crumlin and work out how that is delivered from within Crumlin. But that can only be achieved by Crumlin agreeing. And I'm working at the moment with the chairs of the two children's hospitals, and we will ultimately also work with the people in Tallaght, which is part of the General Hospital. But I mean, both the Archbishop and Mr. Frank Dolphin, who's the chairman of Temple Street, are hugely constructive now about saying, look, there's 250 million spent on childcare services in Dublin. We're running, as I said, three A&E departments overnight, which see on average less than 10 people each after midnight, and probably 20% of them are admitted. We're running 3 paediatric surgical services with tiny throughputs each night. We're running 3 directors of finance. We're running 3 directors of nursing. We have to now start saying, we need you to come together. And we need huge cooperation from those voluntary bodies to agree to do that. And I'd have to say that I've been hugely impressed over the last month as we've moved forward in trying to develop that cooperation, which in any event is critical if we're to achieve the golden goal, which is a new state-of-the-art children's hospital. And in that context, Karen, this is critical. While we have to focus on fixing the immediate problems, and this is the solution, as I said, to them, equally, we have to focus on the fact that we have some of the best staffing in the world in terms of trained consultants and nurses, divided up across 3 sites, put into one site. I believe this will be a world centre of excellence